In the cases where you're dealing with knee pain, because this is chronic at this point, what are some things that you see that could cause it and that they could do some things about?
Um, Once again, obviously, hip is going to play a role. Hips and ankles. So if anyone comes to me with chronic pain, the first thing I'm going to do is assess every part of their body that is remotely connected to where that pain is. Because a lot of the times where the pain is isn't necessarily the actual problem or the cause. It's where the symptom is. So I need to assess how the body moves and to determine where I think the actual problem is. So effectively, the knee only goes where the ankles and hips tell it to go. Right, the knee's not figuring out anything of its own. So if my ankle doesn't rotate or move properly, if my hip doesn't rotate properly, then all the different movements I'm doing, if I'm squatting and my knees maybe will be caving in or whatever, then I'm putting just a constant stress on my joint that it wasn't really designed for. Now, once again, in a week or so, it's not going to be a problem, but years down the line, that's going to cause a problem. So the first thing I'm going to do is check all that. Um, let's assume though that there's no issues with hips and ankles, and then we'll go to the knee. So one thing that people almost no one I ask or speak to has ever looked at how much their knee rotates and how much their shin rotates in their knee. For a properly functioning knee, your shin has to rotate, plain and simple. So back to the space in the hip, the same thing happens with the space in the knee. Like the knee is the knee capsule itself. As I flex and bend my knee, if I don't have enough space in that capsule, there's not enough space for that movement to happen. I'm going to have not necessarily bone pushing on bone, but we've got tendons and ligaments and everything in there, and it's causing a lot of stress if there's no space. So we want to have enough space in the joint so that as I'm flexing and bending my knee, the two heads of those bones can actually move around without rubbing on things. So we can test that by the rotation of the knee. So that's the first thing that I would do. Can your knee rotate or not? It should rotate a little bit internally and then a bit more externally. If it can't, that is literally step one. Because if you don't have enough space in the joint, you are going to have problems no matter what, because it's just not functioning properly and it's just putting too much pressure on all the tissue in the joint itself. And then outside of that, it's training it through its full range and full range of motion. So a lot of my training will start with getting the range of motion that we deem that your body needs so that other parts of your body don't need to compensate. And then the second thing is training the connective tissue of that joint. Once we've got those two things done, then I will progress on to muscle strength and whatnot. Um, Generally speak, as a rule of thumb, the way to target connective tissue is I need to target and strengthen and train the tissue while it's at its completely lengthened position. So I don't have to do this with a squat to start with. I can literally sit on the floor, grab my shin, and then passively, so I'm not using my leg to do this, I'll just pull my shin in or my heel as close to my butt as I can. And I'm just going to go to as an acute angle as I can get before pain exists, right? So I never want to be doing this through pain. And I'll get to there and I'll isometrically load that tissue because I want to start using all the tissue, all the connective tissue that runs over the front of that knee. And I want to train it at its fully lengthened position. So I'm sitting on the floor, so my body feels safe, my nervous system feels safe, and then I'll isometrically load it, which means I'm contracting the muscle, but there's no movement happening. So if you can imagine, I'm sitting on the floor, I've got my hands wrapped around sort of the front of my shin, I've pulled my heel in towards my butt. I will hold my hands on my shin and start putting pressure from my shin into my hands. So I'm effectively trying to straighten my knee, but there's no movement happening because my hands are holding it tight. I'm going to start super, super light. I'm going to do it at like a 5% intensity. So just starting to use the tissue, because I want the tissue to start being used at its fully lengthened position. And then we'll progress from there. So we'll progress in intensities, in durations of time. Then we'll get to some eccentric work but the safest way to do it is to sit there in as fully flexed position as I can, and then isometrically load the tissue into there.